Well, with the development of ipilimumab, there was never an obvious relationship between progression-free survival and survival. In fact, the interesting little nugget of information is that in the original trial that led to the approval of IPI in 2011 by the FDA, PFS was the primary endpoint. It became clear early on in the development of the drug in that registration study called the 020 study that PFS was probably not going to be very valuable because we had lots of info from other phase 2 open label studies that PFS wasn't associated with response and with survival. So the FDA in its wisdom actually allowed the endpoint of that trial to be changed to survival, overall survival. Thank goodness they did because that was a positive study. Yet with PD-1 blockade, I think PFS is probably going to be a pretty good surrogate endpoint, as is response of a certain duration. So I think the FDA as a registrational endpoint is now accepting of PFS in melanoma as an endpoint. It's now accepting of responses of a certain duration as we saw with TVEC, or PFS or RFS as we saw with IPI as adjuvant therapy. So you see, the more effective drugs you have in a disease, the less or the more difficulty you have using survival as your endpoint, because if they fail drugs X and Y, they can go on to drugs A, B, and C, which might prolong survival. So survival now will become a very difficult endpoint. So yes, PFS and to some degree response rate, as long as it's of a certain duration, will become much more important endpoints as a surrogate for the ultimate endpoint, which if you're a patient, it's overall survival.